Hey everybody, Dr. Diane, your libido expert today. Today we are talking about what to do if you're on hormone replacement therapy and your libido is still not back, or if you're on hormone replacement therapy and your libido came back but went away again. And I want to take a moment to say that this particular video is inspired by something that we had received in the comments asking us about this particular question. So please do, as you listen to this video, if questions come up, please do post them in the comments. We try our best to read as many of them as possible. And if we can make videos out of them to support you guys and the community even more, we really want to. So it helps us so much when you guys comment to make videos and content that are related to what you're struggling with and what you need support with. So thank you so much in advance for doing that. Let's dive in today. So it is very, very common, right, that you go to the doctor and the first thing that happens is that you get put on some sort of hormone replacement therapy or have that conversation, especially if you're entering a perimenopause, menopause, or even a post-menopause stage in life. Now, oftentimes, this helps libido, not all the time, but one of the things that can happen when the libido comes back on and then goes away again, one thing that can happen is the body sometimes makes something in higher amounts called sex hormone-binding globulin. So with hormones in the body, it is not just about how much we have. It's about how much is available to the cells. And when we start supplementing, when we start taking hormones either through natural versions or through prescription versions, oftentimes what happens is the body starts making more and more and more and more of sex hormone binding globulin. When we make more of this, it binds to the hormones and less of the hormones are available to be delivered to the cell. Our body responds only to the hormones that are delivered to the cell. So we can have a ton of hormones in our body, but if the cells are not getting the hormones, if they're not receiving the hormones, so to speak, it's almost pointless. So sex hormone binding globulin, when we have too much of it, our cells cannot utilize the hormones that we have. So when we take hormones, sometimes what can happen is that our sex hormone binding globulin gets too high, and then we don't have these hormones available to the cells, so it's almost like we don't have hormones at all from a cellular perspective. So the first step to do is to consider, if this is you, is get your sex hormone binding globulin tested. It's a very easy test, very standard test. Oftentimes you can do this with your conventional doctor, don't even need many times to go to an OB doctor. So that's something, and this is true, this statement is true for women and men, right? We both make sex hormone binding globulin. So you want to get that checked to see if that's the problem. Then you can do things such as Shilajit or other herbal therapies that can help to lower that sex hormone binding globulin in your body, allowing the hormones that are there to actually be recognized and used by your cells. Secondly, the second huge point here is that for many people, hormone replacement therapy is not the only problem. So sometimes if we get on HRT and it's helping for a little while and then it stops, sometimes that's because it was only one part of the problem. And sometimes when we start, it's like this initial boost, but then the body starts to show the other imbalances. The other physical imbalances could be problems in our circulation, in our nerves, and our nerve conduction and nerve flow to our genitals, in things like stress and stress hormones, in pelvic floor function and muscle tightness and ligaments' ability to relax and contract properly, and even things like metabolic issues and blood sugar issues. So all of these can be other reasons, for example, why you might find that your libido is low. And then the third point here is sometimes it's more than just the physical. That's why on this channel, I'm not just talking about lab tests. Like, yes, we have to talk about them. We have to talk about the medical reasons behind low libido, but other reasons behind low libido really are interrelational. So many people find feeling bored with sex. So many people have fantasies that they want to share with their partner and don't. It's estimated more than half of women have fantasies that they've never shared with their partner. And this can be due to fear. This can be due to embarrassment. This can be due to not, worried they're going to be shamed. This can be due to nobody just telling them how. But the point here is that beyond the physical reasons, so many people are not having the type of sex or experience that is actually allowing their pleasure body to come alive, that allow us those sensations to really be felt fully. And when that's the case, you're not enjoying it as much. And when you're not releasing as much dopamine and oxytocin and those magical hormones that are driving you to come back and back and back and continue to have that interest, right? If you ate the most yummy chicken dish that you can imagine your favorite meal ever, and let's say that you ate that every single day. The first week, you might really enjoy it. The second week, even if it's your favorite dish, maybe even weeks 3 and 4. But if you are eating that every single day for 6 months, you can get bored and sick of it. And so that's not saying that we have to have different lovers or anything like that, but it is saying that we need to find ways of bringing a little bit of passion and newness back into our sexual, adventure. So, if your favorite dish is say chicken parmesan, well, maybe you keep the chicken, right? But maybe all of a sudden it's like, okay, well, chicken cacciatore and barbecue chicken. And, you're doing all these other dishes still with your lover, right? You're still there connected with your lover, but you're finding different ways of exploring your pleasure body in a way that's healthy for both of you, but also creating that newness, that foundation. We're going to talk more about fantasies this month too. So make sure you stay tuned in for that. But to summarize everything, get your sex hormone binding globulin tested. Consider all of these other physical root causes. Consider talking to your partner, making sure that you know your body's needs, preferences, your pleasure body, and finding ways to talk to your doctor. If you need help with any of this is all the kind of stuff we do at My Libido Doc. So look down in the show notes about how we work with people to help them really get their libido back on track, to have healthier, happier, more loving, more connection relationships with themselves and with their intimate partner. Thanks again for listening. Please leave your comments. Please subscribe. We'll see you next time.